Good evening, one and all. We welcome you all to the international webinar series on holistic health, well-being, and sustainable development 2025, commemorating Azadi Ka Amrit Mahotsav, nation celebrating 77 years of independence, and United Nations Sustainable Development Goals 2050 to 2030, and Viksit Bharat at 2047. Also commemorating World Breastfeeding Week from August 1st to 7th as part of awareness and campaigns in collaboration with Sri Holistic Health Foundation India and Sri Research Institute Center for Arts, Sciences and Wealth. So before we start our sessions, let's take the blessings of Almighty.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः
With the blessings of Almighty, we shall continue with today's commemorations. Today, we are commemorating International Day of Awareness of the Special Development Needs and Challenges of Landlocked Developing Countries on 6th August. Of the total 32 LLDCs, 16 are located in Africa, 10 are located in Asia, 4 are located in Europe, and 2 are located in Latin America. The smallest LLDC is Bhutan, less than 1 million people, and the largest is Ethiopia, 135 million people. The average distance of LLDCs to a seaport is 1370 kilometers. Kazakhstan is located farthest from the sea, 3,750 kilometers, followed by Afghanistan, Chad, Niger, Zambia, and Zimbabwe, with distance from nearest sea coast in excess of 2,000 kilometers. The severity of challenges faced by the LLDCs is further enhanced as 16 of 32 LLDCs are least developed countries, in short known as LDCs. Approximately 40% of the urban population in LLDCs live in slums, which is around 100 million people. More than the double number of people in LLDCs are undernourished compared to the rest of the world. So when geography hinders growth, like landlocked developing countries, LLDCs lack territorial access to the sea, leaving them dependent on transit neighbors for a route to world markets. This geographic disadvantage drives them transport cost, introduces avoidable delays, and exposes LLDCs to any political or economic instability along those corridors. The results are stark. Average transport costs are more than twice of the neighboring coastal states. Export opportunities shrink. Foreign direct investment falls and economic growth slows. When a transit country is itself a developing country, often the case intra-regional trade remains modest. So why this day is relevant? As we are at a pivotal moment for the 32 LLDCs across Africa, Asia, Europe, and South America, home to over 600 million people, LLDCs face steep development hurdles due to lack of sea access, geographical isolation, and trade costs that are 30% higher than those of coastal countries. To spotlight these challenges, the UN General Assembly has adopted a resolution proclaiming August 6th as International Day of Awareness of the Special Development Needs and Challenges of Landlocked Developing Countries. The first celebration of this day will take place during the third conference on landlocked developing countries in 2025. So the Office of High Representative for the Least Developed Countries, Landlocked Developing Countries, and Small Island Developing States, UNOHRLS, mobilizes international support and advocates in favor of the three vulnerable country groups, 45 least developed countries, LDCs, and 32 landlocked developing countries, LLDCs, and 39 small island developing states, SIDS, each facing their own unique sets of challenges in achieving sustainable development and internationally agreed goals. The office raises awareness about the economic, social, and environmental potential exists in these countries and ensures that the pressing needs of the 1.1 billion people who live in them remain high on the international agenda. Over time, the international community has crafted a variety of frameworks to tackle the various challenges by the 32 landlocked developing countries, resulting in notable gains. Trade agreements have been ratified, border crossing procedures made more efficient, and large-scale road railway networks developed, yet many LLDCs remain constrained by structural barriers and uneven progress in socio-economic areas. To build on the momentum of earlier efforts and address these constraints comprehensively, the UN General Assembly adopted a resolution on 24 December 2024, launching the Program of Action for Landlocked Developing Countries for decade 2022 to 2024. 34. So the the Locked Out campaign unites the government, partners, and the civil society and individuals to raise awareness of the unique challenges faced by LLDCs and build global solidarity ahead of LLDC 3 conference. The campaign brings attention to how these countries are landlocked or locked out and shares stories of individuals in landlocked countries that are breaking barriers and advocates for support across 5 key areas of focus: transport and connectivity, infrastructure development, digital inclusion, climate action, and youth engagement. Today is also commemorated as Clutter Awareness Week, especially in the US, which is held in August to create awareness about much overlooked issue, It takes place from 12th. Clutter in all its forms can do more damage than might believe. It has a nasty habit of eating away of your time and productivity. Clutter Awareness Week aims to highlight all forms of clutter and identify ways to tackle and overcome. So, Clutter Awareness Week was created to encourage us to get rid of those unwanted things that complicate centered living. Getting rid of them can involve avoiding negative people and habits and also donating, recycling, and selling unnecessary items around your home or workplace. Clutter can be either mental or physical, regardless of type. It has a way of consuming time and reducing your productivity. It can hamper your ability to live a calm, happy life. So think about thousands of minutes you could save it only to manage the clear and the clutter from your mind and environment. A cluttered life often means missing deadlines and constant fatigue and can lead to anxiety or depression over time. The first step towards getting rid of clutter is learning to let things go. It might be a physical object, a feeling, or even someone in your life who has a negative outlook. Deciding to remove that excess baggage. So, a cluttered life often means missing deadlines and constant fatigue and can lead to anxiety or depression over time. The first step towards getting rid of clutter is learning to let things go. It might be a physical object, a feeling, or even someone in your life who has a negative outlook. Deciding to remove that excess baggage can be difficult. You need determination and courage, but the rewards are worth the extra effort, and the fulfillment and satisfaction mean you can focus on doing things that being around people that make you happy. So get rid of mental clutter by practicing meditation, taking long walks, or spending more time with family. It's important to know the solution is different for each individual and find a hobby, a happy place where the clutter can't reach you. So do this as often as your schedule allows, and you will see positive changes with time. Learn to be part with stuff and you don't need. Donate, recycle, or sell items you don't have been holding on to purely for the sentimental value. From your office to your personal space, leave zero room for clutter. An organized space is bedrock of successful ventures. Today is also commemorated as Bolivia Independence Day on August 6th in Bolivia. Every year, on days when it falls on weekend, public holidays observed on an alternative weekday. So in Spanish, Bolivia Independence Day is known as Dia de la Patria. The day marks the signing of Bolivia's declaration of independence from Spain in 1825 after so many years of fighting. The day is filled with celebrations all around the country with parades, fireworks, and lots of other fun activities. Bolivia is truly a wonderful place to be during the celebrations of her Independence Day. Bolivia's road to freedom demonstrates what collective will and passion for a home can achieve, no matter the odds. Today is also commemorated as celebrations of San Salvador in El Salvador, also known as Fiesta de San Salvador, observed yearly in El Salvador on August 6th, usually accompanied by 2 days of religious holidays. Day is celebrated to praise the divine savior of world. El Salvador is named after it is a religious as well as secular celebration, as different events are held During the celebration period, the main religious celebration is held on August 6th, as a procession is held with the image. Today is also commemorated as Farm Worker Appreciation Day, which is celebrated on August 6th annually. This day aims to raise awareness about the importance of the work that people do on the farm. The truth is that farm workers, even under the hot summer sun to bring the harvest, every year you can see them as driving by the fields. Most of their work only happens during summer, and this means that many of these individuals return to their home country when the season is over. Farm workers are usually forgotten, and this day is special to honor and thank them for all they have done. So, in the colonial era, most farm workers were indentured servants from Great Britain. They were white men and women and even children who exchanged 4 to 7 years of hard labor for passage to the colonies. Some of these workers were recruited through force and were kept and sold as property with few rights. They lived in miserable conditions of servitude and abuse. By the 1600s, indentured servants were very plentiful enough. So plantation owners turned to an even crueler method of workforce recruitment. The forcible capture of Africans to be converted into slaves. These slaves had almost no promise of eventual freedom, as no fixed period of enslavement was arranged. So African slaves became the primary source of farm labor in the colonies over the next 2 centuries. By the end of American Revolution, 20% of the population in 13 colonies was of African descent, the majority of whom were slaves. In 1808, Congress banned the international slave trade, but not the practice of slavery itself. Today is also commemorated as Hiroshima Day in Japan, in the memory of fateful day and of those who lost their lives. Hiroshima Day is observed yearly on August 6th. The observance serves as a reminder on the day when a nuclear weapon was used, an armed conflict between the United States and Japan, and the lives were lost when an entire city was razed to the ground. Little did they know that effects of atomic bomb that was dropped by the US on the city of Hiroshima, Japan in 1945 would be felt by the next generations of Japanese as well. There was a large-scale loss of infrastructure and a large number of people continued to die years of the incident. So the bomb was dropped over the cities of Hiroshima and Nagasaki in the final year of World War II by the United States, and the first bomb was dropped on Hiroshima on August 6, 1945. And after 3 days, the second bomb was dropped on Nagasaki on August 9, 1945. The bombings killed between 1,29,000 and 2,26,000 people and destroyed the infrastructure of both cities. The Allied leaders had demanded the unconditional surrender of the Imperial Japanese Armed Forces, while the Japanese were presented with an ultimatum upon not abiding by the demands. There were no mention of atomic bombardment. The Japanese government rejected the demand. On August 6, 1945, a modified B-29 dropped a Iranian gun-type bomb named Little Boy on Hiroshima. 3 days later, another B-29 dropped a plutonium implosion bomb named Fat Man on Nagasaki. Reports say that approximately 70,000 to 80,000 people were killed immediately by the blast and resultant firestorm, and a similar number of people were injured in Hiroshima. Months after the bombing, more lives were lost due to effects of bombings in both cities. Along with the lives lost and people injured, there were massive structural damage too. The Japanese officials stated that around 70% of the buildings in Hiroshima were destroyed. Left with no choice, Japan surrendered to the Allies on August 15. The instrument of surrender was signed on September 2nd in Tokyo Bay. This signaled at the end of World War II. However, the residents of Hiroshima continued to suffer health problems years after due to long time radiation exposure. Today is also commemorated as National Fresh Breath Day on August 6th every year as a way of promoting oral health and hygiene. None of us would want to be in company of someone who has foul breath, be it the smell of onions, garlic, sardines, or just poor oral hygiene. Bad breath can be a downer without you even knowing about it. It's social fox pass that will have people avoid you at the office, at parties, or whenever you step out. National Fresh Breath Day promotes the importance of fresh breath and reminds us to check up with our oral health. Today is also commemorated as National Psychiatric Technician Appreciation Day or Psychiatric Technicians Day. Occurs every year on Wednesday that falls in the first week of August. This year, it takes place on August 6th. Ever stop to think about the people behind the scenes who dedicate their lives to caring for mentally challenged or ill people? In short, a psychiatric technician is really just a person who is dedicated to caring for people with any kind of mental illness or developmental disability. So, while the history of psychiatric technicians is tied in closely with the history of institutionalization of people deemed mentally ill, the first asylums were commonly known by many insensitive names and served as a means to socially exclude those who were unfit for society. As early as 872 AD, British travelers in the Far East recorded observations in the Islamic world of mentally ill people being treated humanely, but it took centuries before this approach became popular in Europe and North America. Throughout the 1500s all the ways to 1700s, the mentally ill of society were treated rather barbarously in most hospitals and asylums. It was only during the early 1800s that hospitals began to view mental illness as a medical problem and shifted their perspective to emphasize the dignity of life of mentally ill patients. By the 1940s, many treatments focused on rehabilitating the mentally ill to make them fit for life outside of any institutions, and many different therapeutic programs for integration were developed. As the time progressed, the aim became to destigmatize mental illness and deinstitutionalize patients so that they would not feel detached from the rest of the society. So this introduced the need of the training a variety of other mental health professionals for different kinds of treatments, which is how psychiatric technicians came into being. Today is also commemorated as Solar, Sailor Moon Day. Now we will look at a few aspects of breastfeeding as we were every day. We were discussing on various aspects of breastfeeding. Now we will take a break from daily commemorations and then we'll join for So today we will look at IMS Act. Yesterday we were discussing. Just a second. Okay, today we'll be looking at the infant milk substitutes, feeding bottles, infant foods regulation of production, Supply and Distribution Act 1992 and Amendment Act 2023. This is a presentation prepared by BPNI and IFAN. So we'll look at history, why IMS Act was enacted and key provisions and how companies violate this IMS Act and what central and state governments can do to effectively enforce it and what professional organizations can do and what civil society can do. So IMS Act is Infant Milk Substitutes, Feeding Bottles and Infant Foods Regulation of Production, Supply and Distribution Act 1992. So international code, which we discussed in earlier sessions and subsequent World Health Assembly resolutions, we can see we have various resolutions that were passed, like Codex Alimentarius, Millennium Goals, World Breastfeeding Week, and Innocenti Declaration, Global Strategy for Infant and Young Child Feeding, baby-friendly hospital initiatives. We all have already, discussed on this. It has been presented in earlier sessions, so I'm not getting into detail. So we also looked at breast milk substitutes, International Code of Marketing of Breast Milk Substitutes, and we also briefly looked at why IMS was enacted. It came into force in India on 1st August 1993 as a central government law by notification in the official gazette to protect, promote, and support breastfeeding. So since then, it is also officially implemented, and it was strengthened by the amendment. Again, it was amended in 2003, enhancing the protection level. And in 1993 itself, the rules were prescribed and also amended in 2003. So the basic purpose, this statement of objects and reasons, we are looking at since, the starting 1st of August as part of World Breast Week celebrations. Promotion of infant milk substitutes and related products like feeding bottles and teats do constitute a health hazard. We have seen how it can increase various diseases and disorders, and also can pose multiple health hazards to the baby and also to the environment. So promotion of infant milk substitute and related products has been more pervasive and extensive than dissemination of information concerning the advantages of mother's milk and breastfeeding, and contributes to decline in breastfeeding. So because of this aggressive and pervasive marketing, more and more mothers are giving up breastfeeding and turning towards this alternatives, but that is not a good health. That's why nowadays more and more health issues and more investment is happening in health sector, especially more mortality, infants are dying because of lack of proper nutrition and infections and so on. So results of inadequate breastfeeding leads to, we have seen preventable deaths which could have been prevented by breastfeeding, and because of not breastfeeding, we lost so many children, infants. We can see at the statistics more than 1 lakh annually. This is for every year, more than 1 lakh. And when we look at the subcategories, the cases of diarrhea, which is commonly due to pollution and infection and polluted water drinking and so on. So we see 34 lakhs, 7,091 and 524, and cases of pneumonia, 2 lakhs, 24 lakhs, 70,429, and cases of obesity, 40,382, and cases of breast cancer is around 7,976, and cases of ovarian cancer are 1,748, and cases of type 2 diabetes is 87,855. So effectiveness of IMS Act is, in restricting baby milk scales. You can see the graph in China and India. So in India, we can see, as per the Monitor International India Passport Report of Baby Foods 2016, which is almost a decade ago, we can see the percentages, how much effective it is, and the key provisions, as we have also briefly looked at, of IMS Act. We'll look at it. So infant, first is defining what is infant milk substitute and infant feed, so that we can understand, we can have a clear understanding of what exactly these definitions or terms mean. Infant milk substitutes, any food being marketed or otherwise represented as a partial or total replacement for mother's milk for infant up to age of 2 years. Infant foods, any food by whatever name called, being marketed or otherwise represented as a complement to mother's milk to meet the growing nutritional needs of the infant after the age of 6 months and up to age of 2 years. Feeding bottles, bottle or receptacle used for the purpose of feeding infant milk substitutes and includes a teat and a valve attached or capable of being attached to such bottle or receptacle. Promotion means to employ directly or indirectly any method of encouraging any person to purchase or use infant milk substitute, feeding bottle, or infant food. Health worker means a person engaged in healthcare for mothers, infants, or pregnant women. Healthcare system means an institution or organization engaged either directly or indirectly in healthcare for mothers, infants, or pregnant women, and includes health workers in private practice, pharmacy, drugstore, and any association of health workers. So the Act prevents, bans promotion and advertisements to the public. So no one can openly advertise in any media, either online or in print media or electronic media, about breast milk substitutes. And also prohibits giving incentives, like when you buy breast milk substitutes, you are given some freebies along with it. So it also restricts donation to products, educational materials, or equipments. See, sometimes this is another way of indirectly sponsoring. So especially for conferences, workshops, that's why also no, we don't accept any donations or sponsorships or any kind of monetary or material aspects, because in that way they will try to influence us in promoting breastfeeding. So that's why a big no to all these, so that we can concentrate on activities. And Section 6 prescribes guidelines for labeling. It is mandatory, to put labels with adequate information, prohibits picture of a baby or a mother or graphics to increase sales. So this is prohibited. And Section 7 ensures accurate information through educational materials. So educational materials, awareness materials are produced in a systematic manner periodically and are made available through various platforms like print media, electronic media, online, and so on. And Section 8 also bans promotion and displays in hospitals, clinics, chemist shops, or general stores, anywhere. They cannot advertise, these breast milk substitutes openly in public. And it also prohibits those who are producing these breast milk substitutes are prohibited any kind of donations or contributions on the pecuniary benefits to healthcare workers and their associations, because indirectly they will be influenced as they seek some kind of benefit, and they, ultimately why they are paying them, because they want to promote their products. So that's why it prohibits contribution from giving as well as taking from these breast milk substitute manufacturers or wholesalers, dealers, agents, and so on. So it also bans commission on sales. Generally, what happens when you are doing business or when someone is doing business, whichever is giving more commission or more benefits, they try to sell those products. But at what cost? Not at the cost of our lives or not at the cost of our future, right? So first thing is breast milk. The priority is breast milk has to be promoted. So that's why these kind of, sales or commission is also prohibited and banned. Now, someone should be monitoring, right? Who will monitor? Who is going to report that we all are? We all are equally responsible and we should be very vigilant. We are the whistleblowers. Section 21 of 1 authorizes or authorizing personal organizations for monitoring violations of IMS to make a complaint. So here internationally, FAN is working and nationally, BPNI is the monitoring agency. So apart from this, there are food safety officers, authorized class 1 government officers, and voluntary organizations notified by Government of India, like as we have discussed, Breastfeeding Promotion Network of India, BPNI, Association of Consumer Action on Safety and Health, ACASH, Indian Council for Child Welfare, ICCW, and Central Social Welfare Board, CSW. So, when someone violates, so that is a offense, that is a criminal procedure applies in the IMS Act. Section 23, an offense punishable under the IMS Act is bailable and cognizable. And under Section 12, provisions of the Code of Criminal Procedure 1973, 2 of 1974 relating to the searches and seizures apply to every search or seizure made under the IMS Act. So when someone is violating, even it may be the manufacturer or the wholesaler or dealer or agent, whoever is violating by advertising, promoting, or trying to persuade any health professional or any establishment to promote breast milk substitute, they can attract these penalties and criminal proceedings. So this is the Gazette saying that BPNI is officially authorized by the Government of India to monitor IMS Act in India. And Food Safety and Security Association of India, Authority of India, which is a statutory body under Ministry of Health and Family Welfare, also issues as advisories in a timely manner. Here we can see one such advisory to all states and union territories and designated offices of FSSAI all over India. Advisory regarding strict compliance with provisions of infant milk substitutes, feeding bottles, and infant food regulations of Production, Supply and Distribution Act 1992, 41 of 1992, as amended from time to time. So BPNI, which is a monitoring agency appointed by the Government of India, it also assists Government of India on ongoing monitoring of all of the IMS Act, capacity building and awareness generation, documentation and reporting, technical assistance, and legal action. Now we have seen already in brief how companies violate the IMS Act. So research sponsored by Nestle. So these companies also sponsor conferences, workshops, seminars, and so on to promote research activities on their food and bring out research outcomes saying that this is breastfeeding substitutes are very much important, essential, or they are crucial or they are mandatory, like that in similar. So that's why I also keep saying sponsored research, they have a hidden agenda. They have an outcome already decided. So they will fund you only because only when you show them the results they want. So they definitely, when they are investing, they want what they want to show to the world through research work. So that's why. So these breastfeeding substitute manufacturers are banned from sponsoring any research or research publications or research events like conferences, seminars, and so on, including as mentioned, and also reaching to association of doctors through webinars. So this is also not permitted. Sponsoring conference of Indian Dietetic Association, offering sponsorship for conference participation, gifting equipment to a Delhi hospital, selling bottles on discount. See, all these are violations, right? These all are prohibited, but they are doing. So these all are violations. So whenever you see that such things are happen, you have to report. You have to take a screenshot. You have to take a photo and report through a Google form or send it to BPNI, and it will take time. Now, we can see so many times so much violation is happening. Now, what government is doing, right? So it has given various guidelines, instructions, including ICMR, Secretary Health Rights to state governments, and state governments have also taken action on them. So respective, when such violations are reported and they are verified and they are reported to concerned authorities for action. So once they are reported for action, the respective state governments also have taken action. We can see here. So there is also a huge outcry on various media, print, electronic, online. You can see rising use of infant formula is harming environment and the impact you can see. So what more can be done to implement IMS Act official? So notify authorized offers from among district state health officials for periodic monitoring of the IMS Act. Organize orientation meetings of the authorized officers on how to implement and monitor the IMS Act. Raise public awareness about the provisions of the Act. Develop and publicize an annual report. And actions by the authorized officer: develop IEC materials for public awareness, put up hoarding advertisements about its provisions, develop guidelines for clearance of the conference of health professionals in regard sponsorship grants by baby food companies. Check on the chemist shop for any special displays of baby foods. Check any other promotional activity as prohibited in the IMS Act. Launch investigation and initiate prosecution where it is needed. So, role of health professionals: organizations refuse to accept any kind of direct or indirect sponsorship from baby food or feeding bottle companies. Plan and conduct awareness of members. Take disciplinary action against the members if they flout the provisions of IMS Act. Respect conflicts of interest resolutions of the World Health Assembly. Act as a watchdog and keep a close watch on the promotional activities of the baby food and feeding bottle companies. Report any perceived violation of the Act to the Government of India or state governments. So for breastfeeding mothers, there is an assistance through Stanpan Suraksha app. So you can see the screenshot of this app. And finally, we can conclude saying that IMS Act is a potent tool to protect breastfeeding from aggressive promotional activities of formula feeding industry. So violations of the IMS Act continue. We have seen how. So we need to prevent by creating more awareness and saying no to such feeds. And enforcement of the IMS Act needs more focus and effort so that no one is left behind and no one is left away without being, if they have contributed, fine. If they have. So with this, we shall conclude this presentation. So till here, if you have any queries, you are free to ask. Use chat box. If you have any queries, we can try to answer. So with this, we shall end today's commemorations and celebrations. Tomorrow, we will look at various aspects of breastfeeding. So keep joining us, and we request everyone to quickly fill up the feedback form, which has been raised in the form of polls, and also attend daily so that every day has a different certificate. So you can attend daily to get certificate for all days. Those you inform your friends also, because this is most rarely conducted topic, and you will also get an opportunity to learn. And also, so we request everyone to quickly fill up the feedback form before leaving the platform. So see you all tomorrow at 6 o'clock with the same joining link at the same time. Take care. Good night.